Good afternoon, everyone. My name is Dr. Mark Bloom, and I'm the Chief Medical Officer for Molina Healthcare of Florida, where I've served Floridians for the past 13 years. We are committed to providing high-quality care to the people of Florida. We are also fortunate to have so many community partners that offer incredible care and services to help families live healthy and independent lives. Molina is committed to working with Florida policymakers, private sector leaders, and community-based organizations to promote resiliency and economic self-sufficiency by aligning with programs such as the Florida Department of Children and Families, Hope Florida Pathway to Prosperity program, and the recently established Step into Success workforce education and internship pilot program. Recently, the MolinaCares Accord and Molina Healthcare of Florida launched its MolinaCares for a Healthy Florida initiative, investing over $700,000 to improve access to behavioral health, maternal child health, and health-related social needs, including resiliency programs and resources for Florida's families. The MolinaCares Accord is our commitment to improving the lives and well-being of our communities by supporting organizations and programs that bring meaningful and effective services to those who need it most. The Accord also hosts virtual panels such as these to bring together local experts and leaders on the subject to discuss solutions for some of the most pressing health-related challenges within our state. Today's panelists are comprised of individuals across various sectors of the industry with decades of experience and unique perspectives on the topic of economic empowerment and resiliency and how they drive towards positive health outcomes and overall well-being. Before we get started, I wanted to make a few administrative items. We are recording today's event and will be posting it online at molinacares.com. We encourage you to share the recording with interested parties who couldn't join us today. Excuse me. All participant lines will remain muted, and attendees are encouraged to submit questions through the Q&A or chat feature, and we'll do our best to group similar questions and ask our panelists for their thoughts, if there's time before the bottom of the hour. Before we turn to our esteemed group of panelists, it's my pleasure to introduce a very special guest who will kick us off. State Senator Corey Simon's post-football career was inspired by his mother, who in his words, quote, worked hard every day of her life to give me a bright future. After a sterling gridiron career as a defensive tackle with the Florida State Seminoles, where he was a star on a national championship team, he was selected in the first round of the NFL, where he played for 8 years. Upon retirement, he put his energy into community leadership, founding Corey's Kids, a mentorship program in Tallahassee. He has served as the CEO of Volunteer Florida and as a member of the Florida Children and Youth Council. He was elected to the state Senate last year and has already solidified his position as a go-to policymaker on supporting Florida families through educational opportunities and community support. It's truly my honor to introduce Senator Corey Simon.
Thank you for that warm introduction, Dr. Bloom. And I thank the Molina Healthcare of Florida and MolinaCares Accord for all that you do for our state and our communities they serve. Through your donations, volunteer efforts, and broader commitment to building stronger communities, you have made a difference in the lives of so many Floridians. When I think about what Molina has been able to do for our great state, I think back on my time before I was a state senator. It was my time at Volunteer Florida. And you all stepped up so big when we started our program, our Healthy Mind Summit, for our young people, wanting to make sure that our young people understood the impact of behavioral and mental health. And it was Molina that came to the table, wanting to help and be a great helpmate and teammate. And so I thank you for that today. I want to highlight the role of our community providers, our organizations participating on this panel, Branches, Family Scholar House, and Lee County Homeless Coalition. You all play an important role in keeping families together and providing them with the resources and wraparound services to keep Floridians employed, happy, and healthy. I want to take my hat off to the Florida Department of Children and Families and our great First Lady for their Hope Florida Pathways to Prosperity program. This program has been so important because what it's done is it's matched the private sector with our public sector, with our nonprofit sector, and with our folks from our churches to build such a strong community. We need that resiliency for us to push forward as great Floridians. This legislative session will highlight that resiliency message even more as we focus on ways to keep parents engaged with their children that are struggling with mental health and behavioral health issues. I want to take this time to say a big thank you to the MolinaCares Accord for recently launching the MolinaCares for Healthy Florida and investing more than $700,000 to make sure community partners can reach as many Floridians as possible. It is so great to be with you today. Thank you, Dr. Bloom, and the community partners for keeping up the great work.
Thank you so much, Senator Simon, for your time and for all you do to improve the lives of Floridians. Molina Healthcare of Florida is proud to partner with community-based partners that are on the ground providing residents with the resources they need. The panelists joining us today represent some of the best of these organizations we have to offer in our state. It is now my pleasure to turn it over to our moderator, Dara Kam, to introduce those panelists. Dara is a senior Capitol correspondent who has been covering state news for more than 25 years. In addition to her daily coverage, Dara hosts a popular podcast, Deeper Dive with Dara, that dives into covering the biggest issues in the state. Dara?
Thank you, Dr. Mark Bloom and Molina Healthcare of Florida and the MolinaCares Accord for bringing together today's expert panelists, and thank you for allowing me to participate. I've been reporting from here in Tallahassee, covering state government and politics for quite the while, and I'm really excited to have a chance to listen to what these experts have to say on these very, very important topics. We are going to be hearing first from Kathy Dykstra, who is the CEO of Family Scholar House based in Louisville, Kentucky. Family Scholar House has more than 25 years of experience serving individuals and families in need of support. Their successful operation of campuses of affordable housing and service facilities have earned national recognition, and they will soon be opening facilities serving Jacksonville and Orlando. So welcome to Florida. Michael Overway is the executive director of the Lee and Collier County Homeless Coalition, which brings together agencies that support homeless Floridians. The coalition advocates, educates, and promotes awareness of the issues and obstacles facing homeless individuals in Southwest Florida. And we are happy to also welcome Christine Coronado, Associate Director of Financial Wellness for Branches. For 50 years, Branches has engaged children, youth, adults, and families in Miami with a broad menu of services that provide wraparound support by helping develop and maintain real-world skills. Their holistic approach provides everything from one-on-one financial coaching to transportation solutions and career training. Thank you to each of you for all you do to make sure each Floridian has the opportunity to thrive and follow their dreams. And just before we get started, in case we have guests who've just joined, I just want to remind everyone that we are recording today's event, and the MolinaCares Accord will be posting it online at molinacares.com. All participant lines will remain muted, and attendees are encouraged to submit questions through the Q&A or chat feature, and we will do our best to group similar questions and ask our panelists for their thoughts if there's time before the bottom of the hour, as Dr. Bloom just said. So, as I said at the very top, we are going to begin with Kathy Dykstra. Kathy, can you tell us a little bit about how your organization helps families in need?
Thank you so much, Dara. So from our perspective, Families in need benefit from both short-term support and long-term solutions. And short-term support can take the form of connections to community resources to meet their immediate needs, help applying for government benefits, referrals to address physical and mental health issues, help with food insecurity, shelter, short-term housing, or things like childcare and basic household items and family needs like diapers and work uniforms. These are important, but from our perspective, sustainable self-sufficiency really comes from those long-term solutions, such as education, workforce skills, stable, affordable housing, and financial literacy, just to name a few. Our professional staff members are great listeners and skilled at engaging participants in problem-solving life's challenges. Through our partnership with MolinaCares, Family Scholar House is offering both that short-term support and those long-term solutions to Florida residents seeking to get on with their life in the best way possible and to support their families on a pathway to prosperity. And reaching out to get help is as simple as a phone call or an email. And we're putting both in the chat so everyone will have access to that information. Thank you.
Thank you very much, Kathy. Short-term and long-term solutions. I really love that. Michael, can you tell us about the Lee County Homeless Coalition? How do you help raise awareness of the issues facing homeless individuals?
Sure, Dara, thank you so much. The coalitions were originally founded as coordination entities. In other words, they were based around this idea of a continuum of care and all the providers from food pantries through permanent supportive housing programs. But both the state and the federal governments needed these coordination points. And so they established these coalitions as an entity that can help to not only educate our local community on what homelessness looks like by conducting our annual homeless point in time counts, but we also then can help educate our state and federal legislators. And we're very fortunate in Florida that we have folks in Tallahassee who listen, to the issues that we have today around things like the lack of attainable or affordable housing, and or other issues that relate to homeless services. I think the other thing that is important to note is that coalitions are really looking for like-minded entities to bring together, right? So it doesn't mean that we're all homeless service providers. It means we all have a passion to want to serve, right? We want to serve folks who are in need in our community. And a lot of what we try to accomplish is homelessness prevention, keeping folks from falling into homelessness. And we do that by coordinating with entities like Kathy's and Christine's around the state to ensure folks have opportunities to stay stably housed. And that's what Molina has brought into Southwest Florida through their funding of our Bridges Out of Poverty project. They've given us an opportunity to launch a program to let folks see a new pathway forward, right? See how they can change their lives, not have their lives changed for them. Right. I think we all have seen when clients are vested in their futures become much different than if agencies have to script it for them. So, our primary responsibility is really truly wrapped around this idea of strategically planning, building capacity within our communities and our continuums of care, and then throwing this inclusive net out to all service providers who can help dialogue those who have lived experience in our state.
Thank you so much, Michael. And now, Christine, please tell us a little bit about Branch's mission and the services you provide.
Sure. Thank you, Dara. Yeah, so our mission is to serve, educate, and inspire people through student, family, and financial wellness services. But we do this in partnership with our communities, just like Michael mentioned, right? We provide a continuum of services that foster financial wellness and long-term success. We do this through one-on-one personal financial coaching sessions. So each of our participants can sit with a certified financial coach to help individuals build their credit, build assets, or any type of financial goal they want to establish for themselves. We also offer financial education for our children and youth program, We also have a micro business program, which equips our entrepreneurs to grow their knowledge, skills, and gain access to the resources that they need to help achieve sustainability within their business and to grow and to build management acumen, business management acumen as well. We also have the Miami Community ID program, which serves as an accepted form of photo ID for select county services throughout the county in Miami-Dade. Our Transportation Solutions program also provides families financial education, as well as personal one-on-one financial coaching to remove any type of financial barriers that are keeping them from accessing reliable transportation to get to work, to drop off the kids at school, to get to doctor's appointments, right? We also lead the Miami Tax Pros VITA Coalition. We offer year-round tax preparation services, as well as I-10 processing services at no cost to the participants. Lastly but not least, we also house and operate the United Way Center for Financial Stability, which offers a full range of financial stability services to help enable working families and individuals achieve economic stability.
Well, I'm really blown away by all of the gamut of services that all the participants here collectively provide. And, for many years, I've been hearing about many years how services are siloed. And I love what you all are doing to break down those silos. So thank you so much for letting me participate today. I want to just remind participants to submit your questions via the chat feature. And Kathy, I'm going to turn back to you and ask you, how does your model help build healthy and resilient communities?
First of all, communities are only as strong and resilient as the people and families in them. And Family Scholar House is proud to be a collaborative partner with community service providers, educational partners, education and workforce partners, and also state, federal, and local government. We see this, again, as a continuum and as a resource where we're all in this together and working together towards the goals that our families want for themselves. So with these resources, when you work together, you're able to leverage the best resources available for the best solution for a family's needs. One of the unique aspects of our program is our ability to assess self-sufficiency and track progress. So a few years ago, we built out our own database, customized, proprietary, on the Salesforce platform with Shield level encryption. And with that, we're able to track 238 fields of information for every household we serve. That allows us to not only get the basic demographics, but also a lot of other information that assess and address trauma, and then provide a place for us to put all the touch points that a family will have with our staff and with the staff and organizations in the community. And where this is most impactful is with the Arizona Self-Sufficiency Matrix. So we are able to record and track the domain scores of the Arizona Self-Sufficiency Matrix. And unlike school, where you get a GPA and you have grades and you have test scores, or work where you have a performance evaluation, it can often be really difficult to assess where you are in life. There's not really a score for life. But using the Arizona Self-Sufficiency Matrix, these are very objective scores. So like you choose which one best suits you and your family, and it has a numerical value. And so as you improve your self-sufficiency, your score goes up. And so we're able to say to someone, 6 months ago, your score was a 42, and now it is a 68, and you did that. And let them own the success of that. And often we find that success leads to additional progress towards their own goals for themselves, and allows us to be a helpmate along that journey.
That's so interesting. I have to be the grade A, I have to get 100 plus, plus, plus. So I'm not sure how well I would perform in that kind of an environment. But I love, I think that the word empowerment is oftentimes overused, but I love what you're saying. What I think I hear you're saying is sort of data-driven empowering of families. And I just think that's a great idea. So thank you for that. Michael, MolinaCares is supporting your Bridges Out of Poverty program. Can you talk a little bit about this initiative and the difficulty of breaking the cycle of generational poverty?
Sure, sure. So, I think for a lot of folks who are surviving in poverty, their life path, the easiest paths forward for them are generally the ones that are repeatable and something that they can replicate. In other words, they've seen their mom and dad live this way, their friends, their neighbors, and so for them to live that way is normal, right? Is an easy path. What Bridges is doing is we're challenging the mental model of their daily existence, right? So we want them to take the picture of what 30 days in the life of looks like to them, and we have them actually draw that out, right? So they start by listing things like rent's due, electric's due, car payment, insurance, food, doctors, and then we have them cycle through those things in a 30-day time frame to look at where are they hitting stumbling blocks? Where are they achieving? Because it needs to be both, right? We need to have them identify the issues that are creating chaos in their mental models and those that are pathways that we can help them build on to go forward. And so we really help them to reimagine what their life can be by taking out the day-to-day chaos and inserting structure into that spot that helps them. Now, we don't do it for them. We're asking them to do it, right? They develop the mental model. They're drawing out the picture. They come to their aha moments, right? 10 years ago, when Dr. Ruby Payne brought this project to Florida, I actually went through it. And it was so impactful then. I've been waiting all these years to get the right amount of funding in place to launch this project in Southwest Florida. And along comes Molina Healthcare, right? They come along and say, hey, how can we help you get this project launched? In over 4 days, we were able to train in excess of 400 different agency providers in Southwest Florida on this model of again, I don't want to steal Kathy's word, but it's an empowerment. It's a reimagining of people's lives that they create, right? And then we help them to build that model out in their own life, with a goal of either having stability where they're living and removing the chaos, and or a pathway forward where they're not living in poverty any longer. And that training became so successful that today the 20th Circuit Court, which covers the 5 counties along the coast in Southwest Florida, is now going to begin training all of the court case managers in Bridges Out of Poverty. And our 2 school districts, both Collier and Lee school districts, are advancing that idea in their school districts as well. The Collier Sheriff's Department is advancing the idea, and so is the Fort Myers PD Police Department. And what it does is it's essentially a new language, right? We're teaching folks to kind of reimagine this new language in their lives. And it has to start with community providers understanding that no longer can we, in different socioeconomic classes, design programs for folks who are not in those classes. They have to begin designing those programs within themselves first. And so it is all about this whole reimagining of what your day-to-day mental model of life looks like, and then working to deploy that. And so we're really excited that Molina has helped to fund this. We've been able to bring on several case managers in the project. So they're going to work in a class environment with all of the folks who are coming through the program to help them with their modeling as they go forward.
Wow. So I'm listening back to what you, in my mind, of what you were just saying. So a mental model of life, that is great that you've got such great buy-in from the community down there too. Thank you for that. Christine, I'm so glad that we're talking about financial wellness. I just think that's something that is so often left out of the conversation when we talk about mental health and family support. So thank you, Christine, and tell us how financial wellness can set families up for long-term success.
So Dara, yeah, I'm glad you said that because it does play a big crucial role in setting up families for long-term success, right? Think of it like the secret sauce for your family's success of like your financial GPS to help you steer yourself through life, right? So staying on top of your finances and encouraging responsible spending habits or teaching people how to budget or helping them along the way setting up an action plan to save up for a special occasion like saving for college, purchasing a home, or even a wedding, right? Your daughter's wedding, your son's getting married, somebody's any type of specific savings goal that can be stressful, that can lead to more stress, more financial stress within the family, right? All of that, staying on top of your finances can increase, excellent credit scores. Excellent credit scores open doors to affordable housing, purchasing an affordable home, financing options to purchase a car, opportunities to accumulate wealth that can then be passed down to the younger generations in your family, right? All of these types of things lead to less stress, right? Increased overall stability to navigate life's challenges and doing them confidently, right? Think of it as the key to unlocking the future for you and your family. By making those types of steps today, making informed decisions, knowing how to budget, knowing what credit is about, teaching your children what taxes is all about, right? Making those types of informed decisions today about your finances, you can ensure a secure and prosperous future for you and your family that they can then pass down over and over and over again.
The secret sauce.
Secret sauce, yes.
Right. Thank you. I thank you for that. Kathy, we're going to turn back to you now. With the help of MolinaCares, you're going to be serving the Jacksonville and Orlando communities. What have you learned about the specific needs of these communities that you'll be addressing?
Thank you so much for asking. First, I'm pleased to share that we have already begun serving the Jacksonville community through our response center, as well as with an on-site regional coordinator connecting with individuals and family in the community. And our Orlando regional coordinator will be starting very, very soon. So when entering a new area, our first goal is to learn about the good work already being done by the good partners there and understand the existing programs so we can plug people into those. We know that we are not the end-all be-all solution for everybody, and we love that we get to work in community with so many other wonderful partners like those on today's virtual panel. And that includes not just nonprofits, but also faith communities, schools, colleges, and workforce partners. We have a lot of folks that enter apprenticeships because of the work that we do. So through our early work over the past 3 months in Jacksonville, we've already served 242 households and seen the following trends in their needs. The first was connections to resources for housing and emergency assistance to prevent utility cutoff. Support to explore career pathways and apply for post-secondary programs and student aid. We've seen a need for success coaching for those early in their educational journey or entry-level employment. And we've seen so many that wanted help in navigating government benefits eligibility and the application process. Of these first 242 households, 88% are Medicaid eligible. And our Florida staff members have already helped 127 individuals and families understand and or apply for Medicaid benefits. They've also supported all of the households that were not already on SNAP benefits in applying to address food insecurity for their families. So these are not unusual trends. This is what we saw when we moved into Texas with the support of Molina. They're very consistent, but once you get in and start addressing this and connecting people to other resources, you really start to see their ability to transition from that short-term support to those long-term solutions.
Kudos to you for helping so many people so quickly. Michael, we're going to turn to you now. I'm wondering if there's a success story out of the Bridges out of Poverty program that stuck with you that you can share with us.
Well, do we have at least the next 4.5, 5 hours available? So, when I first went through 10 years ago, Dara, I saw several single moms, particularly, that embraced this idea of living differently than they had been accustomed to. And these were folks that came into the emergency shelter program there. They had come from such poverty that they didn't have things like washer and dryers in their homes, right? They had to be educated on how to operate the equipment when they came into the emergency shelter. But they went through these classes and they came out the other side with a whole different perspective. In fact, one of them went on to become a Bridges case manager. So she came from this idea of poverty into now leading others in opportunities. And that stuck with me so deeply that as I moved into the role of ED in both the Collier and the Lee Homeless Coalitions, my goal was to try and hire folks, particularly coming out of either poverty or folks with lived experience. In other words, they had been living in homelessness. And I was able to do that. And I'm proud to say today that in both of our agencies, our Bridges case managers both came from living on the streets and in the homeless camps. They come with lived expertise. And if it were not for this opportunity, from my own personal experience a decade ago, to see the impact of that, I don't think we today would have probably been driving that kind of train that we are in Collier and Lee, right? We would have probably been doing things slightly differently. But now we're seeing such amazing successes for folks that are embracing new ideas, knowing that they're their own ideas. They were just somewhere locked away up in their subconscious, right? And we were able to help them work through some of those things. And now these are folks who aren't looking back anymore, right? They're now focusing ahead. They're looking at a different kind of a future, and the opportunities that are being presented to them, even some of the ones that I've already witnessed just in the recent past since Molina has begun funding us, are amazing. The change is amazing. We're seeing the change across all races, creeds, ethnicities. People are engaging the process and seeing what a difference that bridges in their lives, how they can, see a new life going forward for themselves. So we're very excited about that. And I think none of this starts without personal experience, quite frankly. And I'm grateful to some of those folks that I got to go through it with 10 years ago that helped to open my eyes and my heart to a different way of looking at folks in understanding opportunities in a much different fashion.
Well, I really appreciate that. As someone who's been in recovery for many, many years, I really appreciate and know firsthand the power of peer support, and really like that you are breaking that intergenerational cycle of trauma and poverty. So kudos to you for that. All right, let's turn to you, Christine. How will MolinaCares support help you expand your service offerings in the 305?
Yeah, so thanks to the support from MolinaCares, we're happy to say that we've already helped over 200 hardworking families in Miami-Dade County provide by providing financial wellness services. They came in to do one-on-one personal financial coaching appointments where they self-determine their own goals. We help them develop, their household financial spending plan, their savings plans. We connected them with the resources they needed. Some of them didn't have bank accounts. We helped them open up bank accounts, savings accounts. We helped them, build credit by, opening up a credit building product. They were non-existent in the credit world, where now they can, start slowly, improving their credit score. Financing for a car, business financing, business grants, as well as building social capital if they do have their own small business. Right, we have a network of business mentors that they can connect to, for that help that they need. Families can also be connected in different types of ways that will help support their income. A few of the other virtual panelists have mentioned, SNAP applications, Medicare applications, Medicaid applications, even applications, to get childcare. Those are the types of connections and resources we help our participants with to help support any type of cash flow problems that they have existing. And then through our youth financial education program or youth education and financial support, a lot of our college students or most of our young adults in the program that are graduating, going into college, they'll also be able to have the support to access financial support for their post-secondary education planning. We'll help them with their FAFSA applications to make sure that there are no issues. Once they graduate, they can move on without any issues to start their college career.
Get them when they're young, right?
Yes, absolutely. And it works. It really does. You'd be surprised. A lot of our kindergartners love it.
Well, I'm going to ask everyone to weigh in on this final question. How have you seen your work to support resiliency and self-sufficiency lead to improved health outcomes? And Kathy, we'll start with you.
So I have the benefit of a very data-informed model. And so that's been incredibly helpful, but it's those anecdotal stories that stick with you. We've gotten to see single mothers who earned the education necessary for careers, 62% of them choosing careers in healthcare, where they could then enter that career and give back to their community. We've gotten to see them raise amazing children and buy homes and become role models for their families and for those participants coming behind them. In each and every instance, this has led to improved scores across the Arizona Self-Sufficiency Matrix domains, reflective of all the social determinants of health, and also led to improved outcomes for their children. We track their health and well-being also. And so healthier adults, healthier children, brighter futures for both, healthier communities all the way around.
Great. Thank you, Kathy. Michael, let's hear what you have to say about improved health outcomes from.
Sure.
Yeah.
So, Dara, and I think Kathy laid it out pretty well. We have to look at data, right? We have to understand what our impacts are. But I think when we look at how we have such strong linkages between housing, healthcare, and mental health care, those things can't be ignored. We have to understand that those things are intertwined with one another. So, for example, we had a gentleman a number of years ago that we tracked who was experiencing homelessness in the community, chronically homeless. On average, he was running the community costs somewhere in the neighborhood of about $42,000 a year between healthcare services, mental health care crisis unit services, jail stays, right? And so, it would have been cheaper for our community at the time to rehouse him. It would have cost us somewhere in the neighborhood of about $14,000 to $16,000 a year to rehouse him, right, as a community. So I think part of what we have to look at is how can we evaluate people who are in need of healthcare and mental health care services when they're not in areas such as a home, right, where they're safe. We've got to put in the safety and the food security versus food insecurity factors in order to bring things like healthcare, mental health care into that environment. Otherwise, we're going to continue to treat folks where they are out in the streets or in the camps and have little to reduced positive impacts on them, right? And so I think without having a strong connection between the three, for years and years and years, people talked about the fact that, housing first had to be what housing first is. And that's, housing with optional treatment services. And while I don't disagree with that as a basic premise, I think we have to understand that when we do rehouse folks, that we have to make sure that we bring forward the provision of healthcare services and the provision of mental health care services very rapidly. Not too long ago here, we started a project in Collier because we were seeing an enormous amount of senior citizens hitting the streets because of the high rental rates that we're experiencing down here. And so these seniors who were first-time homeless had a lot of mental health crisis, which was also leading to healthcare crisis in their lives by their new homelessness, right? So the PTSD was affecting them both mentally and physically. We started rehousing folks, right? We're like, okay, we're going to rehouse them, get them back into apartments as fast as we can. We did that work. What we found, though, was that the property managers and the landlords were calling us saying, hey, so-and-so still isn't doing that well, that we haven't seen them much, or we're concerned that their rent is now late. And so we were asking EMS to go out and do field service calls just to make sure that folks were okay, wellness checks. And so ultimately from that, we developed a project down here called Seniors on Firm Footing, which is basically where we're rehousing them. We do what we do best. We have another community partner that's doing follow-ups with them every 30, 60, 180 so on days. And then our senior center provides geriatric healthcare and mental health care services. And we were getting them connected. We found that once we connected the healthcare, the mental health care piece, while they were in housing, their stability then began to become more resilient, right? Versus this up and down they were having just because they were behind a door and sitting on a couch didn't make them well, right? And so we had to make sure that we were bringing all these other services alongside of that. And once we did that, and once we had the proper folks doing that, the experts, then we found that the stability rates of those that we were rehousing became much greater. Today, we have a 97.3% housing success rate over 2 years once we rehouse somebody because of tied in healthcare and mental health care services.
Wow. So again, I feel like I'm repeating myself because I am, but breaking down the silos. And also what I hear you saying is treating the whole person. And that's really fantastic, those numbers.
Well, I think,
Thank you.
Dara, I think we had to learn that you can't be everything to everybody, right? You have to sort of stay in your lane to do what you do really well, keep doing that. And then you bring in other community partners like Kathy and like Christine that do their work extraordinarily well. And you let them do that work, right? You step back and you hand those clients off. And I think all of us would attest to the fact that we've had to learn to do warm handoffs with clients over the years. In the past, we'd say, okay, we're done with you. We'll give you a referral. You go over there and see Kathy. Now we're picking up the phone and saying, hey, Kathy or Christine, we've got this client. We need you to bring them in for services. We can still do the referral, but without the connectivity of community partners, the clients continue to struggle. It's like looking at a scatter chart, right? You see all these points all over the chart. That's not what a continuum is. A continuum is a very linear, very smooth thing meant to go from point A to point B. So we expect now clients can enter anywhere in that continuum process and move forward instead of having to try and navigate like this all over the place, right? So, and that's what collaboration is doing for us today in the state. And I think that's what Molina is helping fund. Yeah, it does. And Molina's funding that. So it's working.
That's great. I on my podcast, I have one of these I have sound buttons, and I keep wanting to hit the sound button for applause, and I don't have it in my Zoom here. So, I'm very impressed by everything that you all are doing, and thanks to MolinaCares. So, Christine, do you need me to remind you of the question? I'm sure you know, how have you seen your work to support resiliency and self-sufficiency lead to improved health outcomes?
So I think we've all learned today a little bit more about, the different areas and how financial wellness and health can lead to more stress, more physical health problems, right? We all know there's a direct link between all of that, right? People start having migraines. You end up resulting with high blood pressure or muscle tension. You just can't sleep, right? All this can lead to a person just needing to spend more money, more doctor's visits, calling out of work because you just don't feel up to it. You don't have the mental capacity to do one more thing, right? What did that add to more? It results in more financial stress. It's an ongoing cycle, right? So the services we provide are essential, and that a participant can meet with a supportive financial coach wherever they're at, virtually, over the phone, in person, via chat on your phone. Wherever it is that they are, that they need to speak with their financial coach because there's something just not working properly within their finances, they can meet with that coach in a safe space to discuss and share any type of financial distresses they're going through at that point in time. So the work that we do helps them access these resources and support that they need to help put together that plan, to help them get out of that financial rut that they may be stuck in It just keeps happening over and over and over, right? Having us as a resource and everybody else on the panel, like Michael and Kathy, their organizations, all of us will contribute to the overall well-being of better Florida families, right? We're going to contribute to the overall well-being of all our Florida families, and thanks to MolinaCares, we're super grateful for that.
I think every one of us can identify with how worrying about money just can, you can't sleep. I don't know of many people who at some point in their life haven't had a worry, at least one, about how they're going to pay this bill, or what would happen if this if they needed something that they couldn't pay for. I mean, that is very important work that you all are doing. I think we all can relate to that. So we heard a lot about short-term and long-term solutions. We heard about coordination, education, prevention. We heard about the secret sauce for finances, data-driven empowerment, and career training. And we heard a lot more than that, but those are just some of the things I jotted down while I was listening. So thank you again to all the panelists for sharing your wealth of knowledge with all of us. We've got a couple of questions here. Oh, here's one that with the holidays coming up, do you expect to see more need for your services? Let's see, who'd like to take a stab at that? Okay, Kathy.
My experience may be a little different than others, but it's actually the reverse. There are so many activities during the holidays to provide extra support, extra food, clothing, resources for families, that you see a continuing need. But then when that goes away in January, when credit card bills come due, I mean, I see nodding head, Christine's nodding her head, and all of a sudden, all of that extra support is, I mean, hungry families are hungry year round. And all that extra support goes away. That's when we really see a need, not only for our services, but for the importance of those warm handoffs, those connections to other organizations, because a lot of times families are just not prepared for after the holidays. And in addition to that, many families experience that letdown after the holidays are over. The winter blues. I don't know if you have as much of that in Florida as you do in other parts of the country, but that feeling that all the excitement is over and now this is the doldrums part of the year. And if you combine that with high credit card bills, or maybe fluctuations in the need for their work and therefore the pay that they're able to bring into the household, plus challenges with kids in school and getting back in school and get back to habits, it can be a really difficult time after the holidays, more so than during them.
That's it reminds me of when someone loses a spouse or a loved one, everybody's there with the casseroles, the day after the day of the funeral or leading up to the funeral. And then they, they're a lot of times that feeling of loss sinks in after the fact. And so I always try to remember to check on people 6 months, 4 months after, when everyone's kind of gone. Do we have anyone else want to answer that question about the holidays?
Yeah, I can speak on that. So yeah, it's true. Yeah, every year around the holidays, we do tend to see an uptick for requests and additional assistance, perhaps in the form of Thanksgiving meals, emergency financial assistance for utilities, for rent, right? And people seeking assistance for maybe the adoptive family, for holiday gifts for their children and family. But particularly in our situation, yes, we do see that. But like Kathy said, we do see them again in January. Oh gosh, what have I done? I've racked up a huge credit card bill because that's how I bought everything over the holidays. Well, then that's when we start talking to them. Okay, now we need to start preparing for tax time. because we do have the volunteer income tax assistance program that we do run, we lead the coalition Miami-Dade County. So it's not just during the holidays. We pay particularly close attention through the participants' journey throughout the year to kind of prepare them and let them know, hey, tax time is coming up. Let's discuss a plan. What do you plan on doing with your refund? Perhaps maybe you want to save some of that, for the holidays, put some in reserves. When it comes back around, we have a plan so that you don't keep that credit card debt, recurring monthly interest. We can pay it off. So yeah, it's a thing that happens every single year. But being also that Branches has been in the community for many, many, many years, we do have great referral partners, great warm referral partners, people that approach us every single year, organizations every single year that do give us the option of giving us the assistance to help our participants with those types of particular needs, like meals, utility assistance, rental assistance, or even just to buy small gifts for the children in the family.
That's great that you've got that kind of buy-in. Let's see. I've got a question here for Kathy. How does having a data-driven model help Family Scholar House better impact the communities it serves?
That's a great question. There are a lot of different advantages to having that a very data-informed model. First of all, we can see trends. And sometimes what you think you'll see and what you actually see are not the same. And so we're able to course correct really quickly. But we're also able to give that information back to partners like Molina, like state governments, and other service providers that we work with to help them better understand what we're seeing and how we're working together. It also helps when you're writing grants or providing, feedback on grant money that you've received, what you did with it and what was that impact. As a donor myself, I love the outputs. How many sessions of mentoring did you do, or how many pounds of food did you distribute? But what I really care about is what was the impact of that? What was the outcome? And with our database, we're actually able to see that. One thing I didn't mention earlier that I definitely want to say is that if there are other organizations out there, other nonprofits, we allow other nonprofits to use our database for free. Cost nothing. And their data is compartmentalized off. It's not mixed in with everybody else's. But we remember what it was like not to be able to have that data, not to be able to talk about, very specific outcomes from the work that we did, or from the work that the families themselves did, so that they could see that impact. It also allows us, because we know the cost of the touch points, to provide a return on investment to the community. And so, this dollar did this, and this is what the resulting dollars were from it. So if someone's interested in learning more about how they might become a data associate, please just reach out to me.
Well, thank you for that. We have time for one more question. The question is, how have recent natural disasters impacted your work and the needs of the communities you serve? I'm guessing, Mike.
So yeah, this last fall we had this storm, Hurricane Ian.
Yeah. I didn't mean to laugh. It's
No, it wasn't the first, won't be the last, we'll see for sure. But it was devastating. In fact, it annihilated Fort Myers Beach. Those homes were virtually wiped down to the sandbar. And we had a lot of other homes that were decimated. And I think here's the thing, the community had an emergency plan. We were prepared. The loss of life was minimal because the community planned together and it executed that plan together. We were fortunate in that Lee County government, Lee County Human and Veteran Services is led by folks who are they have great foresight. And they knew that we were going to be in this situation days before. The planning was executed again very, very well, but they were inclusive of everybody in the community. They brought in, not only the continuum of care, but they brought in the faith-based partners across all sectors of faith. And began planning for what is this going to look like. Today, we know that we're going to be in a 4 to 6 year recovery period in Lee County alone. Our housing is hugely impacted. We have a lot more folks now who are living in poverty than ever before. Just in Lee County, we had 300,000 FEMA applications filed for assistance, and that's only tip of the iceberg stuff. So we know that the natural disasters are going to keep coming. I think the difference is that today we're or for this storm we planned. Loss of life was minimalized, and we were able to start reconstruction as a community very quickly.
Thank you. Do Kathy or Christine, do you have any?
We've been lucky down in Miami not to be directly impacted by a hurricane. I think we were in the path of being, and then it shifted, or I'm not even sure. There's just so many every single year. I can't keep track of all the names and all the storms. But I mean, in 2017, I particularly remember there was Maria and then Irma, back to back, right? We adapted very quickly to respond to those types of multi-dimensional challenges, because they're often, right? So after Hurricane Irma and as well as the pandemic, right? Some of our local partners and selected us to manage the delivery of emergency financial assistance and support. So we were helping the community fill out their FEMA applications or any type of application they needed support in, because our office here just happened to have power and internet access at that point in time, right? So we open up our doors for anybody that needed the assistance. If we didn't have the capacity or the expertise, we would find someone that could come out and help us apply for that particular type of benefit. So we aid and support in the community members when they just need it most. We're here whenever we're needed.
Well, I want to thank all three of you again, Christine, Michael, and Kathy. This has been so informative. You have a wealth of knowledge and resources that you're providing to Floridians. Thank you. And I am going to turn it back to Dr. Mark Bloom.
I just want to add my thanks to an incredibly interesting discussion, as you said, Dara. So thank you so much to the panelists. I learned a few things, and I appreciate that. Hopefully our attendees did as well. So thank you to the panelists. Thank you so much to Dara. Great job as the moderator. And I hope the attendees enjoyed this as well. If anyone wants more information about how Molina supports these community efforts, please go to molinacares.com. Thank you all and have a great afternoon.